All right, so it looks like we're recording. I would have to spend some more time in the settings to really make this do what I want to. There's many more options than when I've used it in the past. So it's also sharing my screen, which isn't going to be very helpful to the people watching it because it's just going to show this grid of our Google Meet and then my little head down here in the corner. So hopefully, if I set this on a bedside table and record, let me try and focus it on our guy here. Maybe I'll even move it over here so it's closer. Looks like they started tearing down some of the marker boards here so that we can think about getting those head walls up. All right, so hopefully that's going to be good. Okay, so one of the first things that you're going to do is wash your hands and bring the tray of food into the patient's room. Now, this is for an adult, an inpatient that for some reason is unable to feed themselves, whether it's an injury or it's a neurological disorder. Okay, so you want to make sure that you've got a clean surface to set your tray on. This tray is kind of a mess because I have a variety of equipment here, but you're going to want to make sure that this overbed tray table is cleaned off, that there's not hearing aids that could get thrown away. And if they have dentures, you want to make sure that those are clean and they've had their oral care for the day so that they can eat. Okay? So their dentures would be in if needed. You're going to do your Fab 5. You are going to use some hand sanitizer or let them see your hand hygiene. Introduce yourself. Say, what's this person's name? Robert Green, 63-year-old male, okay? So you would do your Fab 5. Say, Robert, we have your lunch here for you today. Are you feeling hungry? And let them know what you're going to do. So then the angle at which you feed them is very, very important. Does anyone recall from the reading what angle someone should be sitting at in order to be fed or to eat?
45 to 90 degrees.
45 to 90. So I would say Mr. Green right now is about 45. The higher, the better. Okay, if you can imagine leaning backward trying to eat something, like an actual meal with a fork, and I'm not talking about finger food, it can be uncomfortable, and I think I would choke. So the higher, the better. I'm going to raise him up so that he feels like he's sitting as upright as possible, like you might be at a table. Now, if you're at a table, you're sitting even more than straight up. We're actually not only at a 90-degree angle, but we're leaning in over our plate. So the closer you can get that patient to feeling like that, the better. Now, keep in mind, too, that when you sit them straight up, their legs may be very uncomfortable. It may even stretch their hamstrings. So you may need to bend the knee of the bed a little bit just to provide some additional comfort for them. So I'm going to do that for Mr. Green. Just bend the legs a little bit. I got to move the camera. All right, so I'm going to go through some of this equipment on the tray so you guys can have an idea. Okay, so I have this typical food setup, which is how you might see something in the hospital. It's got a cover for sanitary reasons, and it has this rubberized plate on the bottom that would hold the food plate, and that's also for sanitary reasons, but it helps keep the dish warm. Okay, and then inside here I have a divider bowl, and this one actually is it's an infant feeding plate, and it's got that rubber or silicone suction pad so that it's not moving all over. This is helpful with pediatrics, but adults as well. Now, when we were talking about the clock face, I want you to picture this clock face on this plate. So this would be 12. This would be 6. Okay? It helps when directing the resident to the different areas of food on the plate. Why might you need to direct them?
Aren't they supposed to like alternate between like solid and liquid food?
Yes, that's one good point. But why might they not be able to tell what food is where? Like, let's say their corn is at 3 o'clock and their turkey is at 6 o'clock. Courtney said if you pin your video on the screen, it would make your entire screen your video. I don't know if it's showing a pin. Are you talking about on Google Meets, Courtney?
Yeah, so if you go over your like little picture of yourself, it'll show like that little pin.
Oh, yeah.
On it.
Okay. There we go. Is that better? Yeah, and I think the people watching the video, then it would be up close. Perfect. Thank you, Courtney. All right, so the point I was getting at is that sometimes people may not have the best vision. So if they can't see what's on their plate, their appetite might not be as good. If all you can do is smell something, you might think, oh, I don't even want to eat that. Or I can't even picture what that could look like. I'm not sure that I want to actually try that. So you could say your corn is at 3 o'clock, Mr. Green. Your turkey is sliced and it's at 6 o'clock. And that would help direct them and allow as much independence as possible. Now, if it were me, or if I think about my mom, for example, it's kind of shameful or guilt-ridden to have someone feed you when you're an adult that should be able to feed themselves. So it's kind of uncomfortable to think that you're going to be laying there and you can't use your arms and someone's actually feeding you. It can feel demoralizing. So it's important to let them be as independent as possible. Okay, that's true for kids too. Infants, it's great. They love it. You're going to feed them. You can wipe their mouth and do all of that. It doesn't hurt their feelings. But for children or adults, that can really take away from pride and ego and independence. So keep that in mind. All right. To help with independence, we have some different types of containers that can help patients continue to feed themselves for as long as possible. So one of those things is utensils that are actually attached to a big foam handle. So you can do this with any utensil because it slides in right here at the end, and that way you can still clean the utensils. But these large, soft grip utensils allow someone who has lost some of their strength or dexterity to be able to continue to hold onto the utensil, which otherwise would be too thin for them to grasp. All right, another thing is that they make utensils that are curved, and they actually do this for infants too. Spoons and forks that are curved so that your range of bringing the utensil around isn't as far if you've lost some of your range of motion, or you're a baby with really chubby arms and you can't get that spoon around to your mouth. So this right here is an example of a curved fork. So it kind of looks like a knife. It's not. Okay, it's a fork for adults so that you can come around and bring that food in. They make these in knives and they make these in spoons as well. Another thing is this spoon, and it really doesn't look that much different except for the handle's kind of fat, but it's actually weighted. It's very heavy. Okay, what are your ideas on why a heavy fat spoon might be helpful? If you guys want to speak out or even add it in the chat. Oh, Nathan raised a hand. Nathan, go ahead.
It with people with tremors, it helps cut down on the little micro movements that people have, so it can decrease the amount of spilling or
right. So if you're
falling off.
Yeah, that's perfect. Excellent. So, for example, if my hand is tremoring, I might have a fine tremor or even a heavy tremor. This kind of calms some of that down so that rather than the food spilling all around and not quite getting it to your mouth, like if you're eating soup, for example, this can really be helpful for those residents. All right, this right here is actually a juice cup. So the inside is glass. The outside is a rubber that has a little bit of a give to it. So it's easy to grip, but the shape of it is easier to hold than a traditional cup. Okay, so someone who might not be able to normally give themselves regular liquids could have it in a cup like this. Okay. Normally, what you're going to see in the hospital is a cup that looks like this, coffee mug. They sometimes serve soup in it as well. It's kind of grippy over here. It's insulated to keep liquids warmer, and it can fit a regular lid. Okay, this is a typical bowl in the hospital, insulated as well, easy to wash. Okay, this wouldn't be for someone who has difficulty feeding themselves. This is for everyday patients that don't experience any difficulties. One other thing is this. Any guesses onto what this might be? The lighting's horrible in here for doing videos. Any guesses?
Maybe to make the plate higher.
What was that?
To make the plate higher.
I like your thinking. You're close. Very, very warm. Not to raise the plate, although that's a great idea on how that might be helpful for someone. What else could this be for?
Does it just like hold the plate? Like they like set the plate in there?
Yes. Okay, you're getting even closer, but why would we want to set the plate in this?
It's harder to get to, I guess.
Yes, you guys are doing well. I like the thoughts. Okay, but look at this. Now, I've put it around the plate. What do you think that might do?
It makes it harder for stuff to spill out.
Yeah. Yeah, it provides a little bit of a guard. So if I'm eating and I'm coming around the edge here, it's easier to scoop because things can't spill over as easily. Okay, excellent job. And then I've got a couple of kiddo forks that got something on them. I don't know what, but anyway, these are some kiddo feed myself early on in life forks. You wouldn't give a baby that's just learning to eat a fork, although these are soft and the outsides are shorter. So it's a safety fork, but not for first time feeders. This is as they get a little bit older and they're learning how to maneuver some different utensils. Before I can finish this demonstration, I actually have to go get my cord because my computer is saying low battery. So how about we take about a 5-minute bathroom break, get something to drink, maybe a little snack, and I'll be back with you in less than 5. Okay.
Wait, when are we coming back?
In like 5 minutes.
Sweet.
Okay, I think we are at the 5-minute mark. Hopefully you guys have made your way back. Let me lock this bed. All right, well, I'm going to go ahead and get started with the actual feeding demonstration. And then I will give you guys your assignment and you will be free to go with that. All right. So the first thing that I'm going to mention actually is this product. It's called Thicken Up. And that is what I was talking about, that you can actually add to liquids if someone's regular thin liquids make it too hard for them to swallow. So this one's clear and it says instant food and drink thickening powder. Most of the time you can get it at Rite Aid or CVS or from medical supply stores. On the back, it actually says desired consistency with a little table. Nectar-like, honey-like, or pudding-like. And based on the amount of liquid, it tells you how many scoops of this. So I will show you the little scoop and the little granules. It reminds me of like a clear Jell-O, and it's a powder form, and you would add it based on the consistency. So you guys can imagine how thick honey is, pretty thick. Pudding is even thicker. You can't really pour it, it just kind of plops. Nectar is halfway between actual liquid and honey. So it can drip much, much faster and easier than honey. It's almost like if you were to heat honey up. And the dietitians, along with the physicians, would decide the desired consistency of the patient's liquids. Okay, so right here is what we call a clothing protector. You don't want to call it a bib, which they did for a long time, because you want to maintain some of the dignity for that patient. But these are very large waterproof clothing protectors so that the patient doesn't need a bed bath or a clothing change after mealtime. So you're going to want to get that in place, and you are going to want to take the cover off the patient's food and let them know based on the clock face what food is where. Okay, I've got my additional edge, the rim, the plate rim here. I've got my suction plate to hold things down. I would even take it off the tray and leave it right on the table. Okay, and then Mr. Green is holding his large fork, and hopefully we can assist him and prompt him in feeding himself the best that he could. Okay, so you're going to need a washcloth to provide the patient hand hygiene before you were to get started, and you're going to want to make sure that their oral care has been done, which I mentioned, but you also are going to need a warm, wet washcloth so that you can continue to maintain their hygiene on their face and their chin while they're eating. Okay, it's not like with an infant where you want to scrape or push food back into their mouth. That again can really be detrimental to their pride. Okay, so you might use a wet washcloth or a dry cloth to keep their mouth clean, but under no circumstances should you be scooping and putting it back into their mouth, which I have seen done a number of times, both in long-term care and in the hospital. Okay, so really think about that patient's dignity. If it is a child or a teenager, especially those young people or young adults, you especially do not want to do the infant style of scraping the food and pushing it back into their mouth. That's very, very important in terms of the patient's self-respect and dignity. Okay. When they're finished, you would make sure that they're all cleaned up, hand hygiene again for the patient. You're going to lower them back down. If it's okay, and they aren't ordered to stay sitting up for a certain period of time after they eat. Your job at that point is to calculate how much intake they've had. So when we do our skills fair and you guys have the opportunity to do that, we will say this cup is 240 milliliters and they drank half. How much liquid did they consume? They also had, they ate about 25% of their plate, which was solids. How would you record that? If they drank a carton of milk and only took a quarter of that, how many milliliters is that? And then we would total that. When we start talking about catheter care, we'll also talk about output. So we want the amount of liquids that they're taking in to match the amount of liquid coming out so we can keep an idea of their hydration status. Okay, so we would measure any urine coming out. We will have more time to practice calculating that intake, but that is exactly what that means. It's the fluid intake amount and the solid intake amount, and being able to add some of those things up. All right, so any questions, you can let me know. Send a message to my cell phone. I'll go grab that. I haven't had that with me for the last half hour or 45 minutes. So let me know if you have any questions, and be prepared to be able to demonstrate some of these feeding techniques. And make sure you watch the other videos in my YouTube playlist. Okay, thanks a lot. Hope you guys have a good Tuesday.